We are currently using the Whitley H35 Hypoxia Workstation with the HEPA Filter unit. The work that we're doing with the H35 workstation is that we're using it to provide an environment in which we incubate cardiac spheroids, which we form from stem cell derived cardiomyocytes mixed with endothelial cells and cardiac fibroblasts. And this allows the cells to coalesce over a period of time, usually up to about 2 weeks. And then what we do is we allow them then to form a spheroid, and then we can incubate these cells with a range of different drugs and analyze cardiovascular toxicity. Obviously, having the Hypoxia Workstation is critical for this type of work because we want to incubate the cells in a more physiological environment that they would be exposed to within the human heart. And obviously the Hypoxia Workstation allows us to generate oxygen levels that reflect the in vivo physiology that these cells would be exposed to. The oxygen concentration that we would use for our application would typically be around 8 to 12% if we were trying to reconstitute normal cardiac physiology. However, for a lot of our work, we actually want to induce periods of ischemia or low oxygen levels, and that's why we chose the oxygen profiling system that goes with the H35, which allows us to pulsate or allow like a periodic low oxygen level of about 1 to 3% that would actually mirror hypoxia or ischemia that would happen within the cardiac muscle. And then we can obviously see how our spheroids or cells respond during that short periodic exposure to the low oxygen. The HEPA filter obviously allows us to maintain sterility during the period of time of 2 weeks to 6 weeks in which we culture the cells, and we don't use antibiotics for our cell culture because we're looking at drug toxicity. So obviously having that sterility is absolutely critical for these longer periods of time. Another feature that's been particularly useful for us is the humidification unit, which allows us to maintain a predetermined level of humidity over a long period of time. Certainly for 2 to 6 weeks, this is absolutely critical so that the cells don't dry out. So an example of our work is shown here with these cardiac microtissues, which are formed from the 3 different cell types that we mix together, and you can see that these pulsate with a regular rhythm. They're about 100 micrometers in diameter, so they allow us to manipulate them and add drugs and see changes in structural and functional parameters. So my experience of working with Whitley and communicating with them has been very positive. I mean, what was very beneficial for me was actually to see how the actual station is put together, and it really helps you visualize what type of extras you might need with that system, how ergonomically that's going to work with the particular system that you want. The delivery was very efficient as well, and obviously the service of the unit has been very good. So overall, it's been a very professional package, I would say, that Whitley have put together for us.